So now let's get down to business. If everybody in this room contributes 200 hours in the next year and $200 in order to get a full-time staff, you'll turn around the congressional delegation on single payer, with the exception of Ron Wyden. Does that sound off the wall? No. What we do constantly is we exaggerate the opposition because we don't organize ourselves in opposition. And like anything else, the weaker we think we are, the stronger we see the opposition. The stronger we see ourselves, the opposition is not so prominently overwhelming. So, Sigmund Freud appealed to our sense of guilt. Jung appealed to our sense of shame. I think we better expand our sense of shame and jettison our sense of guilt. Shame is a very powerful motivator. So let me start increasing our sense of shame. 1945, World War II over, U.S. #1 power in the world, Western Europe devastated, cities, countryside, starvation, unemployment. They demand from their multi-party system and their co-ops and their trade unions universal health care for all, and they get it. They demand paid maternity leave, paid sick leave for family, paid daycare, they get it. They demand, comparatively to us, decent wages, decent pensions, they get it. They demand 4 weeks paid vacation, they get it. They demand decent public transit, they get it. For all their people, all their people. They demand tuition-free university education for all, they get it. 64 years later, we have none of these for all our people. The Republican and Democratic parties obstructing competition from third-party independent candidates in ever more nefarious ways. Didn't deliver in the 40s, they didn't deliver in the 50s, in the 60s, in the 70s, in the 80s, in the 90s, and they're not delivering now, and they're never going to deliver because they have been corporatized, monetized, and frozen into a career perpetuation tunnel that has turned its back on the American people. Okay, how many of you voted for Obama? Okay, how many of you voted for me? Okay. Gee, I got a majority somewhere. Okay. Now, this is the great year of the Democratic betrayal, big D. Even I never dreamed that the cowards in Washington would have such a minimal sense of their historic significance to stand up for the crushed, the sick, the injured, the excluded, the damned, the gouged, that they had no sense of historical significance other than their personal political narcissism. And that includes Barack Obama and his spectacular upward mobile career move of last November. It includes the Democratic majority in the House and the Senate. It includes the Congressional Black Caucus, with a few exceptions, that will do anything other than challenge a Democratic president. And the Hispanic Caucus, with very few exceptions. There's a John Conyers with H.R. 676 on single payer. There's a Dennis Kucinich. There are a few more, but they are a tiny percentage, and they are being pilloried and undermined and excluded by their own leadership. So, let's go to Canada for a moment. There was a survey of Canadians. The question was, who's the greatest Canadian of them all? The person who won was Tommy Douglas, the Premier of Saskatchewan, who started the single-payer effort, universal health care. This man had guts. He faced down a massive doctor strike. Can you imagine any politician in Washington who will face down a doctor's strike today? The first bill The first stage bill to get universal health care was 6 pages long. The second Federal Health Care Act of Canada that completed the job was 13 pages long. They spend 10% of their GDP to cover everybody. We're at 16.5% of GDP this year. 50 million not covered, you've heard, tens of millions underinsured. The bill that is worming its way, or shall we say slithering its way through Congress, has already hit 1,400 pages. And it's an atrocity of Swiss cheese holes, ambiguous language, waivers, incomplete coverage, compulsory purchasing from gouging health insurance companies, unaudited overbilling practices. At what point do we get upset? Let me try to upset you. And you would not be here if you weren't active. So when I say you, I'm talking about your friends, your neighbors, your relatives, who you get on the phone and they agree with you and you beg them to go to the city council meeting to sign a petition for the Progressive Party to get on the ballot, to call or email their representatives. And how many times have you heard them say, yeah, fine, and they don't do it? Or, I'm too predisposed, I'm too busy, I'm too preoccupied. Yeah, I'm dropping out of democracy so I can suffer even more and spend less time with my family and more time in congested commutes and lousy commercial daycare. All right, let's bring it down to scale here. And we don't often see this. Never in the history of the country have there been more books and articles and testimony and documentaries exposing corporate abuse, denouncing corporate abuse, exposing politicians who sell out, diagnosing the problems of concentrated power, oligarchy, plutocracy, proposing brilliant reforms, and then they go and vote for the least worst of corrupt politicians who have sold our country to the highest corporate bidders when they're not bailing them out in Wall Street. Now, pardon me if I see a contradiction here. That's the liberal intelligentsia. Now, we have to get over this. President Truman proposed universal health care in the 40s and early 50s, and the AMA, American Medical Association, beat him. It was the labor unions against the AMA. The AMA was more powerful. They actually got the personal physicians of the senators and representatives. I mean, can you imagine? You got these lawmakers on a slab and a stethoscope. How are you going to vote? Yeah. Some people thought that was a breach of medical ethics. But it worked. So since then, we've had Medicare and Medicaid in the 60s. And the corporations have been perforating those ever since, undermining them, making you pay a subsidy to get seniors out of Medicare into Medicare Advantage, which is another private health insurance scheme. And so a lot of people don't want to use the word Medicare, full Medicare for all, because it's been ripped off, it's been defrauded. You've seen the programs on 60 Minutes or It's Your Money on ABC or in the papers. And so they use the phrase single payer, which is not my favorite phrase because it always requires people who don't know about it to say, what is that? Whereas just about everybody knows about Medicare. So that's why we say full Medicare for all. And let's get our language straight. The drug companies and the insurance companies are not providers. Families provide. Charities provide, not gouging, profiteering, deceiving corporations. And you have people writing in The Nation and Progressive Magazine using the opposition's language, like detainees instead of prisoners. That's Bush-Cheney language. So let's call them sellers, if you want a neutral term, or vendors. We have to get our language right as well. So look at the present scene. There's a new study in the Journal of Public Health, came out 3 weeks ago, by 2 Harvard Medical School lecturers, professors. These are practicing physicians as well. It is no longer 22,000 dead. It's 45,000. They use CDC data, very careful study. These people know they're going to be scrutinized by the corporations. 45,000 people die every year because they can't afford health insurance. Now, nobody dies in Canada, Luxembourg, Belgium, Holland, Italy, Sweden, Germany, Taiwan, because they can't afford health insurance. They're insured from the day they're born. Now, what does that do to us? You can say, what a rotten system. Well, what about us? What are we doing? Obsessing about the Ducks and their 4-1 record? When you got 800 Americans dying every week? Why don't we obsess about that? 800 Americans, because they can't afford health insurance in the richest country in the world, they can spend $750 billion of your tax dollars for a Pentagon budget and wars in Afghanistan and Iraq and supporting the Israeli military juggernaut to brutalize and occupy the West Bank and of Palestine. And we're dying here. Thousands of people are dying. How about 58,000 Americans who die because of work-related diseases and trauma every year? OSHA figures. 65,000 Americans who die every year from air pollution, horrible deaths, asphyxiation, cancer. EPA figures. 100,000 minimal Americans who die from malpractice in hospitals. All these are preventable, just like homicides in the street are preventable. And that's the key, whether it's criminal intent, profiteering intent, incompetence caused deaths. The key is preventability. Not say, oh, these were criminals who killed people, so we should spend all our security budgets on a criminal gang, and not every day the thousands that are dying. Very silent deaths, quiet, nobody trumpets for them. They don't get buried in Arlington National Cemetery. They just made the country go every day. Rosa Parks was not the only one who knew that it was a humiliation and a violation of civil rights to have to go to the rear of the bus in the southern states. A lot of people knew that. But one day in 1955, she got on a bus in Montgomery, Alabama, and she refused to give up her front seat to a white man who was standing there expecting her to give up her seat and scoot to the back of the bus. She had fire in her belly. She had emotional intelligence. Those workers in the sit-down strikes in Flint, Michigan and Warren that built the United Auto Workers, they put their entire family's livelihood on the line. There was no other jobs that could pay. That's in the Depression. There was no unemployment compensation. There was no welfare. But they put their livelihoods on the line. Can't we be something like them? Just half of them? A third of them? A fourth of them? What happens is that people get numbed to the kind of information that paints a terrible picture, however real it is. A lot of them get numbed. Like, what can we do? It's horrible, we know. We've lost our own friends, relatives, siblings, great-grandparents. What can we do? Well, I suppose we can forgive people for asking that question because they never learned civic skills in elementary school, high school, college, law school. All of these are overwhelmingly vocational or simply trying to keep kids off the street. Now they're putting them in front of computers so they can live more of their lives in virtual reality and not socialize and interact with teachers and other students and connects the classroom with the community, so they study their community and they connect their courses with how to improve their community. So no, that's why a lot of people say, what can we do? Well, first of all, they got to develop a sense of self-respect. That's the first thing. They got to say to themselves, we're no longer going to be people who don't count. We're going to count. We're going to look back at our forebears who stood tall and gave us whatever we like about this country, up against overwhelming odds. How would you like to be an abolitionist in 1830 Mississippi, where the cotton plantations and their thugs were the dictators? How would you like to be one of the 6 women in upstate New York in the 1840s who started the women's suffrage movement? And they fanned out in Kansas and elsewhere, knocking on doors, and the men in the houses would open up the second floor window and throw hot, dirty water on them. And when they demonstrated in front of the White House, right after World War I, they were dragged off in chains and thrown into jail by the police. They didn't have any of the tools we have. You've got everything. Internet, telephone, cell phones, iPods, YouTube, Facebook, if you can get past updating your profile. These kids today, you know. I don't know what they're going to say to their grandchildren when their grandchildren say, what were you doing when this was falling apart, Granddaddy, Grandma? What are they going to say? I was too busy updating my profile on Facebook. Look at the figures. We have a $2.5 trillion health care bill in this country. That's how much we spent last year on health care. $2.5 trillion, 16.5% of GDP. To show you what the curve is like, when Medicare was enacted in 1965, we were spending 3% of our GDP on health care. 3%. At the rate we're going, it won't be 50 years before we spend 50% of our entire economy on health care. And when it comes to the health insurance companies and the drug companies, enough is never enough. That's the nature of a profiteering corporation. Like Lockheed Martin, if you said to Lockheed Martin, tell us when we have enough nuclear subs and supersonic modern fighter bombers, they can never tell you that because they are a corporation. Corporation wants infinite sales and profits. They have no sense of proportion, no sense of boundary, which is why every major religion in the world over 2,000 years ago warned its adherents not to give too much power to the merchant class. Monomaniacal. Profit, profit, profit. And if they collide with the civic values that are far more important for humanity, whether it's health or safety or justice or opportunity, they crush it or co-opt it or undermine them. That's why they warned them not to give too much power to the merchant class. You know, you really can't advance the golden rule and give too much power to the merchant class. So 2.5 trillion. 400 billion of administrative waste by health insurance companies can be avoided by single payer. Medicare spends about 3% of every dollar on administration, and Aetna has gone from 25 to 30%. Why? Look what they pay the bosses. Look what they pay middle management. Look at all the clerks denying claims, avoiding the sick. That's how they make money. That's how they compete with one another. Avoid the claims, deny the claims, and avoid the sick. And we have anarchy here in Washington state capitals. There's no regulation. Even if they're on the books. Look at Dan Meek and others. They got these campaign finance initiatives. You voted for them. And Bradbury, the Secretary of State, was one of the more malicious suppressors of the rights of third-party candidates to get on the ballot. I know that from personal experience. He doesn't even bother enforcing it. And the Attorney General is not enforcing it. That's why Dan has brought another lawsuit to require, through mandamus, for them to enforce it. Now, there's a fellow who's in the office up in the Kennedy School at Harvard University. His name is Malcolm Sparrow. Everyone should know his name. Why? Because he was one of the first to document as an applied mathematician who came out of England, that over 10% of the healthcare expenditure is down the drain by computerized fraud and abuse. That is, billing, fraud, and abuse. Codes manipulated, services not rendered. You know, you get these, we all get these, you know, printouts, right? And he says it could be 200 billion, it could be 3, it could be 4, it could be 5. He's very careful. There's not enough data to take it beyond a certainty of about 10%. Okay? A lot of that would go off with single payer. Because who's doing the cheating? The doctor practices, the hospital chains, and the health insurers. As long as they keep getting more premiums, they don't crack down on fraud worth a darn. They should be our guardians. But they're not. When you hear a death toll of 45,000, that means hundreds of thousands of people every year are sick and injured and don't get treated. Just think of, just roll that out beyond the figures. Take it from your own experience. The family anguish, the fear, the anxiety, the pain, the pain, the pain, the pain, the death, the lost jobs, the shattered income. You don't see that in Western Europe. You don't see that in Canada. What are we made of here? We just like to talk about the land of the free, home of the brave. We pledge allegiance to the flag and end it with those wonderful words, with liberty and justice for all. What are we living, a lie here? Yes. All right, so the key, your success in persuading other people as you double your numbers and triple your numbers and quadruple your numbers and you reach 1,000 and 2,000, fanning out from Portland, is the extent to which not only you get people to recognize, read, and understand the factual atrocities that have been going on for decades. Decades. There were progressive parties 100 years ago who were pushing for universal health insurance. It's when you get them indignant. I don't mean so wildly angry they lose control of themselves. But you get them agitating their emotional intelligence and connecting it to their cognitive intelligence. Throughout history, it's not just people who know. It's people who feel it. I met a lot of people who knew a tremendous amount about unsafe automobiles as engineers, as scientists, as human factor specialists. But I lost some of my best friends in car crashes, in high school and college and law school, before there were seatbelts, which were available 80 years ago. They had them in World War I planes because the pilots would fall out, you know, in those small little planes. Because there weren't padded dash panels, which were on Roman chariots 2,000 years ago. GM going backwards into the future. And when I found out that the engineers were not allowed to put these old, practical, life-saving devices in cars, that's when I went from cognitive intelligence and added fire in the belly. That's what you got to get. And there's wonderful material, wonderful, accurate phrases, a pay-or-die system. Do we really want a pay-or-die healthcare system in this country? If you can't pay, you die. If you can't pay, you stay sick. If you can't pay, you don't get diagnosed. If you can't pay, you can't get the medicines. There's wonderful material. Professors Wollender and Himmelstein, husband and wife, Harvard Medical School, for years have been writing brilliant, precise articles in the New England Journal of Medicine, arguably the most prestigious medical journal in the country. SinglePayerAction.org has great material in Washington. How many people have visited SinglePayerAction.org? That's a really good one. It just started a few months ago. I helped start it. That's the one that had the doctors and nurses stand up in Senator Baucus's Senate Finance Committee. And that It always takes one event to spark something. You know, like Mario Savio being dragged off the steps of Spruill Hall in Berkeley. It always, and that was one, and there needs to be others. You have the mad as hell Oregonian doctors coming to Washington. And I understand they were well received all the way. And now they're staying over because Obama's meeting with the doctors in the White House. And wait, the doctors who are against single payer in the White House, and he's excluding them. See, so they're trying to, maybe they'll picket the White House or whatever. But, I mean, the exclusion of the majoritarian position on health insurance reform, majority of the people, majority of doctors, majority of nurses, single payer, majority position, taking it off the table. I have never seen that in over 40 years in Washington. You know, I've seen majority positions being opposed at congressional hearings when their supporters testify, etc. I have never seen this autocratic, dictatorial, off the table. One time, Nancy Pelosi, Speaker of the House, was at a breakfast with the press. This was about 3 months ago, and a reporter said, right by the White House, a reporter said, "What about single payer, Speaker Pelosi?" And here's her words: "Single payer, single payer, single payer. That's all we hear, but it ain't going to happen. It's not going to happen." How do you like that? It's all you hear on Capitol Hill whenever you propose something that should have been done 100 years ago. It ain't going to happen. We don't have the votes. It's not practical. Oh boy, can you imagine the abolitionists, the women's suffrage, the great progressive labor and farmer leaders who started out with nothing, no electricity, no telephone, no motor vehicles, no passable roads, no money, took on the big banks and the big railroads that were squeezing their livelihoods and families to oblivion. Did they say it ain't going to happen? No. Did they say it's not practical? No. It's hard to even use excessive extensions of words like sniveling cowards that are on Capitol Hill. We've got to stop voting for least worst. Because if you vote for the least worst of the Democrats over the Republicans, they take you for granted because you've told them you got nowhere to go. You're not going to vote for Green. You're not going to vote for any third party or independent candidate. You say to Kerry and you say to Obama, take me, I'm yours. And guess what? They do take you. You lose your bargaining power. And you're so desperate not to have a Republican that you don't even make demands on your least worst choice to pull Kerry or Obama toward your agenda while the corporations are pulling 24/7 in the other direction. So there isn't even a tug of war. You know, when there's no tug of war, what do you think happens? You ever see the rope when there's no one pulling on the other side? All right. When you leave here, tell yourself, how many are you going to persuade to lock arms with you? That's the key. That's where it all starts. You know, we can be a bit trivial here, and we can say, what if the American people spent as much time watching Congress, which after all spends 22% of their income and all kinds of power, what if the American people spent as much time watching Congress as they watch themselves in the mirror? Huh? Years ago, when there was a big struggle on arms control, I was driven to this metaphor, that if the American people spent as much time on arms control as underarm deodorant, we'd get arms control. In other words, there's no excuse for most people. There are people who are really down and out, and they're sick and they're injured, or they're trying to hold down 2 jobs at Walmart wages and care for an ailing parent, elderly parent. But for a lot of us, there really are no excuses. But we're very good at excuses. We're brilliant as excuses. Even though if we just applied to our civic pursuits the same kind of mental smarts as we apply to sports. I mean, have you ever talked to a real sports fan? I mean, the level of critical capacity, historical knowledge about the players, the coaches, the managers. What would happen if the wall was put back 10 feet? What would it do for more home runs for 3 of the players? How about, should it really been should a shortstop should have gone back on this? Didn't you know that this guy dribbles bunts or whatever past the picture? It's unbelievable. They have historic knowledge. They second guess all the experts on the field, and they're passionate. What if they had that same composite mind skill towards civic action? All right, so the answer is, come on, sports are exciting. There's a beginning, middle, end. You know who won. You know who lost. You got your own team. You never give up on your team, even if they're, in the cellar. And politics, citizen action, what is this? Doesn't move me. It's dull. It's boring. Besides, they're going to do whatever they want anyway. They're not going to listen to us. So you know all the excuses. Why don't you go to this town meeting and do what you really would like the city council to do? Because I'm not trying to persuade you. You've already told me what you would like. Oh, I don't have time. Okay, you don't have time. Well, what if you did have time? Well, I don't know how to negotiate things. They use so much legal jargon, the town attorney gets up and so on. Well, what if you did know the jargon? Well, I'm afraid of retaliation at the job. I'm looking for a promotion, and if I take this position, the manager or the boss may not look kindly on me. Well, what if you're not afraid of retaliation? What's the next excuse? How elaborate are we in rationalizing our own futility? And the next time you hear anybody say, I'm not into politics, I'm just not into politics. Tell them, if you're not into politics, politics is going to be in you in very disagreeable ways. So here, Dan Meek's proposals are really very good. Pick up the materials. You got to swing into action here in Oregon. You got the initiatives through. Now you got to get them enforced. Most people, say if the law's on the books, they should be enforced by the Attorney General and the Secretary of State, and you'd want to do that. One last thing, when they talk about the health insurance industry, that's accurate. That's what the discussion is in Washington. The discussion is not about health care. There's a big difference between health care and health insurance. Not that they're not unrelated, but health care involves good diet. It involves exercise. It involves not drinking and smoking excessively. It involves clean air, clean water, safe food. It involves safe medical and hospital services, not malpractice, not negligent, incompetent services. It involves safety on the job. So it's good to always make that distinction, and how single payer is much more likely to further those goals, the healthcare goals, than this profiteering system that's been inflicted upon us.